back to our channel, Dr. B and Mary. Today we are going to talk all about Alzheimer's. So we're going to give y'all an introduction, talk a little bit about the background, some symptoms, and then just what a typical patient might present when they have Alzheimer's. So
yeah,
let's get it started.
All right, thanks, Mary. Welcome back. It's good to see you again. Nice sunny day here in warm Austin, Texas. And so yeah, Alzheimer's disease, it's a very common problem. Many of us who have family members or friends who are in their 70s and 80s, many people know someone who has had Alzheimer's. And so I think it is important we talk a little bit about what that is and some symptoms that can come with that disease. So we've known about Alzheimer's disease for over 100 years. There was a Dr. Alzheimer in Europe who identified a patient who was young now for Alzheimer's. She was in her 50s when she passed, and he did an autopsy and found proteins in the brain called amyloid plaques and neurofibrillary tangles. We know now that these are the pathologic findings in someone who has Alzheimer's. So Alzheimer's disease is a type of dementia, the number one cause, the most common cause of dementia in this country. And it's a subtle disease in the beginning in that the memory symptoms, usually memory symptoms, although other symptoms can be in the beginning, but the memory symptoms can develop very slowly, very gradually, and once they get to the point where they are causing major impairments in life, whether it's difficulty driving to familiar places, difficulty driving safely, keeping up with medications, keeping up with finances, these are some of the symptoms of Alzheimer's dementia, mild Alzheimer's dementia. The important thing to think about with Alzheimer's is that it generally hits people who are older. It's uncommon below 65, very common over 85. About 1 person in 3 over the age of 85 has Alzheimer's disease.
And I know you mentioned previously about her being in her 50s diagnosed. How common is it? I know you said it's not that common, but can you be diagnosed in your 30s, 40s, 50s? Is that something that you do see?
You can. It's pretty uncommon, though. And the people who are very, very young, like you say, the 30s, 40s, and especially the 30s and 40s, those people almost always have a family history, a strong family history. It goes from the grandparent to the parent to the patient and siblings here and there. And that's what we call autosomal dominance. That's just the genetic pattern of that disease. It's extremely rare.
Okay. And
it doesn't usually come out of the blue. So usually there's that family history that you can identify of people who have Alzheimer's disease who are young. If your grandmother had Alzheimer's in their 80s and you have memory concerns right now in your 30s, no offense. Sorry to give your age out there, the whole world.
Now everybody knows.
Yeah, everyone knows, yeah. I'll get in trouble later. But so if someone has Alzheimer's in their family late life and you in your younger years, it's probably not the same thing. We all forget things here and there, but and sometimes it's hard to distinguish. So if there's a strong concern, it is important to see your doctor, because there are things other than Alzheimer's that can cause memory symptoms, thyroid problems, depression, lack of sleep. And so it's important not to miss these reversible causes of memory problems, especially for younger people. Well, good to see you again, and we'll see you next time.
Yeah, thank y'all for tuning in. If y'all do like these video series, make sure y'all subscribe to our channel in the bottom right-hand corner. We'll see y'all next time.